Hello, everyone. My name is Aiste Ramanauskaite, and it is my absolute pleasure to welcome you to UCARE for You patient webinar on pregnancy, birth, and lactation, building the guide for new mothers. This is honestly one of my favorite events, aiming to bring the evidence-based information to the patients and provide them with the skills to better understand and control their disease, by paving the path between those who are affected by urticaria and those who are experts in their field. So now I'm very pleased to introduce you our faculty. So we know that patients suffering from urticaria experience additional limitations and stress in their professional and personal lives. Building a family is unfortunately oftentimes also affected and related with more anxiety due to this condition. So therefore, today we have collected an amazing team ready to provide you with their expertise on pregnancy, giving birth, and lactation. So I'm very pleased to introduce Professor Kocatürk, Dr. Tırnova, and Dr. Lee. So first of all, warm welcome to all of you. And in fact, the changes in women's body during the whole process of bringing a new life into the world is more closely related with urticaria than one might think. Up to 1% of women develop urticaria during their pregnancy, and those who are already suffering from it report significant changes in disease development. Some of them, almost half of them, report a little bit tendency in improving of the skin condition. 1/3 of them report no changes in disease development, and 2 out of 5 patients report that disease has worsened. But more on that will be elaborated by Emek. Emek will go a little bit deeper into the results that we conducted by our project PREG-CU, and we will share with you more insights on the topic regarding pregnancy and urticaria. Then later on, Marlene will elaborate more on medications, chronic conditions, and their possible effects on the baby. And last but not least, Zelal will provide us with the tools for managing maternal health in mental health terms. So this topic is universal. Today, we are connecting 31 countries all around the world, and we always want you to get the most out of the time you spend with us. So therefore, I highly encourage you and ask you to put all of your questions in the question box below, and I'll be sure that we'll get through all of them and we'll provide you with the best possible answers. Moreover, there are still a lot of patients that are in need for support, knowledge, and care. So use your power on being aware of what UCARE does for the patients and spread the message on the social media platforms. Help the others to find the way to UCARE. So at the end of the webinar, we kindly ask you to leave your feedback. We always strive for the improvement. We want to bring you the best possible. We are eager to dive a little bit deeper in the webinar. So without further ado, I kindly like Emek to take the stage and introduce us with her topic a little bit more on pregnancy and urticaria.